today's Medicare EmPower Hour. My name is Erin, and this is brought to you by Blackpoint Insurance, where we help Medicare beneficiaries nationwide learn about the A, B, C's, and D's of Medicare, and we help agents and brokers launch, grow, and retain your businesses. The Medicare EmPower Hour is all centered around helping our Medicare beneficiaries find the care that they need, helping agents and brokers to support their clients with product training, physician information, different ways to potentially grow your business. One of the featured shows that we do on the Medicare EmPower Hour is profiling physician partners in the community that are looking to grow their practice. As agents and brokers, we're constantly, especially now during open enrollment, which began October 15th and runs till December 7th, finding Medicare beneficiaries that are looking for a new doctor. Maybe they want to change a different system of care, but the big key to that is finding a good primary care physician that they can relate to and make sure they can build a relationship for ongoing care. So I love bringing Brown and Tolan doctor Jessica Tsuei onto the show today. She is board certified in internal medicine. She's incredible. She's looking to grow her practice out into the Orinda market in the East Bay, really looking to bring on patients through Brown and Tolan. She takes patients of all ages into her practice. Obviously, we focus on Medicare beneficiaries, but she's looking to grow. So when you have that Kaiser patient who's looking for a new doctor or a new home, or you're looking to enroll someone at open enrollment with a Brown and Tolan doctor, Dr. Tsuei would be a great fit. And I'm so excited to introduce her to you and bring her onto the show. Dr. Tsuei, welcome.
Thank you. Thank you, Erin, for having me at EmPower Hour today.
Yeah, we're so happy to have you on. You're just fantastic. So tell me a little bit about your practice. So you're in Orinda. Tell me a little bit about the team and how you guys work together.
Okay, so I joined Orinda Medical Group about a year or so ago, and it's located in Orinda at a convenient location, I would say, across the golf course. There is about 4 of us in the practice. Including me. There's 3 full-time physicians and 1 part-time physician that spends maybe 2 half days here. The practice has been here for over 4 or 5 decades for those that have lived in the area for a while. It's pretty well known in the community, and my partners have been here for a very long time, and so it is a great opportunity to work alongside very seasoned physician. And it is a small private practice, so the way that the practice runs differs a little bit from big group practices. And so, yes, we are Brown and Tolan physicians. What that means just means that we do take Brown and Tolan insurance. So if you are with Brown and Tolan and have their insurance, I may be assigned to you, or you may be looking for a Brown and Tolan physician that is currently taking new patients. For people that are carrying Sutter, Aetna, Cigna, or other insurances out there, we do take them as well. And us being Brown and Tolan physician doesn't have too much impact on what we do with you. It's not very much different. It's more with Brown and Tolan physicians, we're limited to more of the Brown and Tolan network, whereas other people carrying other insurances, we can refer out to really anywhere. So for example, if you hear a great specialist from a friend that you want to go see, then we can definitely do that referral for you in the correct way.
That works great. And I know, at Blackpoint, we work really closely with Brown and Tolan. We work really closely with all of you. We have a lot of patients that are looking for Medicare Advantage options during open enrollment, because this is their opportunity to shop different plans. So one of the things that we find is there's a number of people who want to move to us, particularly from Kaiser. So Kaiser's this different model of care where people are getting everything kind of under the Kaiser umbrella. So they're really looking for a new home. So would you say that using an Advantage plan with Brown and Tolan would be a great, easy transition for people in the Orinda area if they were to select you as their doctor?
Definitely. And, because this practice has been here for a long time, we have a great network of physicians that we do refer to. So I think I had some Kaiser patients that, came over, and because they've been with Kaiser throughout their lives, they are not quite sure where to go and whatnot. So this is a great place for you to start with or come to, and we can point you into the right places. and the right people.
That sounds so great, Dr. Tsuei. I feel like the most difficult thing for a Kaiser patient in transitioning, all these other plans that are out there often offer richer benefits, comprehensive prescription drug, vision, dental, hearing, the whole 9 yards, but people are so afraid to change because they need that good relationship with the doctor. So just having you out there gives me great comfort. And all my broker friends that are out there, please send patients to Dr. Tsuei so she can grow and help us grow by bringing more patients on board through these very competitive products and carriers that are working with Brown and Tolan. So we're super excited about that. So now one of the things, Dr. Tsuei, everybody talks about primary care physician, main doctor. How do I select one? How do I pick one? How do I know someone's the best fit for my needs? And so one of the things that I always tell my clients, and I know a lot of brokers out there, you tell the same, is that you should try to find a doctor who really has time to spend with you, is trained to treat the whole body. And I have been told that being an internist is a great fit as someone's primary care doctor or primary care physician. And I know you're certified in internal medicine. So can you tell us a little bit about what that means and what people might expect going with an internist for primary care?
Yeah, so you're right, Erin. In general, an internist does take care of everything that could, possibly go wrong with the body, related to any internal or external organs, including the skin, the eye, and whatnot. We are trained in a broad base of knowledge. Like we have a broad base of knowledge, which can be helpful in the first pass of things that can happen, which is great for primary care because the primary care is usually the go-to person. And, very often also, we act as liaisons for our patients to get the correct help or to help communicate with specialists if necessary in the right circumstances. And so I do believe that being an internist allows me to be a good primary care doctor, just because we are trained in that broad base of knowledge. We know a little bit of everything. And then if we need to, we can point you to the correct person as to what we're concerned with.
Especially related to specialty care. That's great. And I feel like people are really counting on that. Like, help me navigate, figure out where to go, what specialist to see. So that's amazing. I love it. So now tell me a little bit about your personal style, right? You meet a new patient for the first time, they come in to see you. What kinds of approach would you have in working with a new person and helping them get all the things that they need?
Yeah, so, there is a general, I guess, script that I stick to in terms of like learning about a new patient. I want to know about you. I want to know about what you do as a job, what your family life is, would you have a good network, a social network of things? And of course, I want to know about your medical history and background, medications and such and such. But I think mainly that for me, my philosophy is to, when I meet a patient and they come to me for things, is to give them as much information as I could to help them in decision making, just with healthcare related concerns and questions. I do tend to individualize my advice. It's quite interesting to see all the different kind of personalities and what things people are concerned with, given their upbringings and family history. So I guess I don't have one approach per se for all the different people, but it's really tailored to the individual. And I'm a big supporter of shared decision making. And so I'm sure if you know some of my patients currently, I do a fair share of that to be sure that I give them the information and we can make the decision together.
Absolutely. Dr. Tsuei, one of the things that impressed me about you and why I so much wanted to have you on the show and feature you for patients in the Orinda area who are looking for a doctor is because of that customized approach that you have, that you treat a person as a person, you get to know them thoroughly, you include them in decision making, and you don't try to make everything cookie cutter, one size fits all. You really build a relationship with them. And what could anybody ask for more in a primary care doctor than that, and then supporting them through specialty care and medication management and all the key things. But getting to know them as a whole person is a big deal because those social determinants of health sometimes are a bigger deal than even the medications or the doctors they need to see. It's all a whole picture type of situation. So you're pretty incredible in your approach. And I think anybody listening would love to have you as their doctor and have a long-term relationship with you. So you're pretty incredible. Now, speaking of being incredible, can you tell everybody just a little bit about your personal history? Because, it wasn't just an easy turn on, right, to be here and become a physician. So give us a little bit about your background and how becoming a internist became a thing of your life, right? What's your story?
Yeah, so I was born overseas in Taiwan, and I was raised in Hong Kong, and I moved to the East Bay in Walnut Creek in eighth grade. So I can safely say now that I spent most of my life here in California.
Gotcha.
I did go to high school, at Northgate, which for some of the people, it's in Walnut Creek, and I went to UC Davis for college. And overall, how I picked my major at that time is just I was more fascinated with science and math, so I chose a major related to that. And becoming a physician really was one of the many aspirations that I had growing up. Including I wanted to go into business and finance. I wanted to become a pilot, actually, which was quickly vetoed by my dad. Like, you shouldn't become a pilot. So anyway, but the true story is, I guess becoming a physician was in part inspired by my great aunt, who was an OBGYN she was trained in Hawaii, and then she ended up opening her own East-West clinic in Taiwan. And she was in practice for many, many years. And I just remember as a kid, we would have these family gatherings, and she would bring her little toolkit type of thing. And so she taught me a lot about medicine and how to practice as a person and looking at a person as a whole, actually. And of course, and maybe TV shows have something to do with it, the ones featuring Doctors Without Borders and all those things. And I do have a love for traveling. And so eventually that's something that hopefully I'll do in the future, because I do have a very young family currently. So for let's see, I finished residency at California Pacific Medical Center about a year or so ago. And prior to that, I did go to Wayne State for medical school. And so it's good to be back to California.
Well,
And
welcome home.
thank you. Thank you. It's also very nice to be back on this side of the tunnel. It makes the commute a lot easier compared to going into the city from the East Bay. But I was pregnant twice during residency, and so I have two very young kids. I have a 1-year-old and a 3-year-old. And my husband is a fellow currently also at California Pacific Medical Center. And so, once my family starts growing and everybody kind of knows their place, and my kids are not as dependent on me to feed them still with the 3-year-old, then I'll do a little bit more traveling. But for now, I'm staying put for sure.
Gotcha. Well, I think what's nice, you've established a great young family. You guys are obviously busy, 2 physicians in the house. That just sounds like a lot right off the top, right? But, you've built up a nice practice, and you're still growing. And I love that you have figured out a way to balance it all, because I think it's always just got to be crazy balancing all of that. And I love as your family grows, you can pursue your interest of travel. I'm pretty sure a lot of the patients you see are interested in that as well. So a fun topic of discussion as they get to know you and you get them on their way. So tell me a little bit about things you like to do in your free time, if you have any, outside of your family, right? Are you still flying planes and trying to do jetting, or what do you guys like to do for fun?
Well, that is on my agenda, actually. I was, eventually I'm going to learn how to fly small planes, and I'm going to go do one of those things called the one where you fly off a cliff on those
Hang gliding?
Yes, hang gliding. So I'm going to be learning that too.
That sounds like a lot. Okay.
But for now, everything is kind of put to a side. So when I do have free time, I usually just spend it with my family, spend it with my kids. I'm working Monday through Friday full time, and so while I'm at work, I have a great nanny that's been with us since my residency with my first boy. And so I feel very, very fortunate to have her. And of course, also my wonderful mom to help with my kids throughout all this time. And I won't even be able to really be here to talk to you guys if it wasn't for them. So
Right.
I do spend a fair amount of time with my family outside of work, and that's really my main activity, you know, probably trying to set up play dates, going to birthday parties, going to the park and whatnot is my other
That
job.
fills it up. You've got an exciting life going on over there, Dr. Tsuei. I love it.
Oh
So,
yeah, it requires quite a bit of organizational skills, I'd say.
exactly. Well, you're just a breath of fresh air for a physician, right? Because people just want everything that you have to offer, right? You are taking patients. So for all my broker partners out there, please recommend Dr. Tsuei to your clients that are in the Orinda area. If you're listening and you need a great doctor, Dr. Tsuei is taking new patients. So please throw her a like, give her love, call the office so that you can get connected with her. So that reminds me, Dr. Tsuei, if people want to get in touch with you or learn more about the practice, what are the best ways to do that?
Well, I would say visit our website. It's a fairly new website. It's orindamedicalgroup.com, and you can read a little bit more about the practice's philosophy and also about the physicians that are currently at this location. And it also has some patient information as well as how to make an appointment if you are interested in establishing with me and with this office. Our office phone number is 925-254-3805, but there is definitely more information on the website that you can find out.
Great. And I noticed, Dr. Tsuei, when I looked on your website, they can book an appointment right there. They can get connected with you. They definitely can get more information. So there's a little link just to press if you want to get an appointment and get more information. So it's pretty easy to use. So want to encourage everybody out there, go visit orindamedicalgroup.com or call that office at area code 925-254-3805. Now, I want to remind everybody that it is the annual election period for Medicare beneficiaries, AEP. It began October 15th to December 7th. There are several competitive carriers, so health plans that contract with Brown and Toland in the Orinda area, and they're very competitive at benefit design. Low or no premiums. They include dental, vision, hearing, prescription, all kinds of bonus features that you can take a look at. And so if you've previously thought that it was inaccessible to find a plan like that, it's available. And here we have Dr. Tsuei eager to grow and take you as a patient. So it's just a win-win situation. Get a great product and plan, work with a great local medical group, and Dr. Tsuei can be your quarterback of all of that as your primary care doctor. And she's incredible. So Dr. Tsuei, I just want to thank you so much for being here with us today. I think you're a dynamic individual. You're really diverse in terms of all of your interests and activities. I think you would just make a great partner for anyone in their healthcare, and we're just so happy to have had you on the show today. So thank you so much.
Thank you so much, Erin, again for having me here today.
You got it. All right, everybody, have a great day, and thanks so much. Bye-bye, Dr. Tsuei.
Bye-bye.